Three, two, one. Hey, this is Josh, and this is the 7th episode of the Status Dramaticus podcast. So, just a little disclaimer for this episode. The family is home, and my guest is my wife, so there's no one to watch the baby, so you're going to hear some noises in the background. You're going to hear some clicking of the dogs clacking on the hardwood floor, and you're going to hear Grayson just babbling in the background in his pit of balls. So, without further ado, with that disclaimer in place, I want to introduce my wife. She is a pretty much brand new emergency nurse. She's still on orientation, even after all of the warnings I gave her about being an ER nurse. She still wanted to do it. So, hey, wife.
Hey, husband. Well, I have been a nurse at least for 3 years, though.
That's true.
I made the switch from med-surg nursing, floor nursing, to the emergency room department. And it has been, it started in March, and it has been quite an adventure already.
Yeah, you came in at a really nice time.
Yeah, I mean, I started March 1st, and 2 weeks later, we were in a global pandemic. So, yeah, I've been able to experience a lot, and I look forward to continuing to do so, because it's not stopping.
Right.
No, not
and
at
I
all.
think it's picking up again with the non-COVID related stuff.
Yeah, for a little while there, especially with the, governor doing the stay-at-home order, people were actually staying home, and the emergency room was actually seemed to be used for emergencies, which was awesome. So there were higher acuity patients, and mostly just that, higher acuity, mostly emergency cases.
And I think that's pretty consistent when we were comparing notes when I was in the ER and you're in the ER. It was like maybe the volumes were down, but at the same time, they were just like the sickest of the sick that was coming in.
Yeah, and, just for those who know, we do work at different emergency rooms.
That's right.
I
can't deal with you at work and home.
Yeah, I couldn't stand doing that. I love you, but,
Well, I got that on recording.
So, all right. So yeah. So far, I have, like I said, I've enjoyed my time in the emergency room. It's different than floor nursing. I wouldn't say one's better than the other or anything at this point. I just it's different. It's a different type of nursing, and that's what I was going for.
Do you think nursing school prepared you better for the floor than it did for the ER? You think it was more geared towards that?
Well, I'm 3 years out, so I will say that my transition from nursing school and onto the floor was, for lack of a better word, easier. But I went straight from nursing school into that. Now, 3 years later, some of the stuff that I know that there was a lot that we covered in nursing school that I just simply didn't use as often as I do now. Just particular lab values and things. I recall them in nursing school. I just didn't use them that much.
So it's like a refresher once you got to the ED, like, because you utilize these things more often.
Exactly. Yeah. Certain medications, just things of that sort. It's just a different kind of nursing. And like I said, not one being easier than the other or better than the other. It's just a different kind of nursing.
Right. So you always wanted to be an ER nurse, right?
I did. I went into nursing school to be an ER nurse. Like they always, I don't know what the saying is or whatever, but like, it's kind of like the thing that you want the most is something that you're most afraid of, kind of thing. Like, I really wanted to be an ER nurse, but I was really, really scared to be one.
You're intimidated.
Exactly. Yeah. So I did floor nursing because I did feel like that was the foundation of nursing, and I needed to have those basic skills. And I'm so helpful, grateful that I did that. And then through the years being with you in the emergency room, and your experiences, and I was like, oh, I don't know if I want to do it,
It's a lot of work.
Yeah, so sometimes you would I would be even more intimidated, but so there was still part of me that always I had to try it.
I'm glad you're scratching it off your list, but now that you're there, is it as intimidating as you thought it was going to be?
No.
Right. The workload's still there.
Yeah, and like I said, it's a different type of nursing.
But it's nothing you can't handle.
Exactly. Right.
And I tell any new nurse that I precept, I tell them that they can do this.
Right. If I can just let myself get out of the way, and that's kind of what I needed to do, is kind of step away from my thoughts and stuff and just kind of do it. And I'm still in orientation, and I'll be done soon, and I still, obviously, I haven't seen anything, in nursing's the type of thing, it's an experience type of job, and you learn as you go, but I come to work eager to learn, and I'm just glad I made the transition. There are parts that I do truly, truly miss with floor nursing. And there are also, parts that I'm really happy I made the change.
Right.
So.
Yeah, I've never been a floor nurse, so I don't know how I would respond to it.
I do like that I can kind of see the two sides, at least two views of nursing, to know what it's like to be a floor nurse from an ER nurse perspective and vice versa.
I guess that's interesting because I always think about the difference, and I put that into perspective as when I call a report.
Right.
Like what the floor nursing cares about and what I cared about for my time taking care of this patient.
And it really is interesting because now I see both sides, and and in my experience, I feel like you got to get report upstairs by a certain time, but then I know what it's like to be the floor nurse, and when I find out I'm getting a new patient and how much time I have to look them up and things of that sort. So it's like both ends have certain restraints, that are affecting that. And so I can see where that report process taking place can be very,
because it's just so different. The example that's always brought up, and like when you're looking at your ER friends and your floor nurse friends on Facebook, they've got like those memes, like patient can't breathe, but then floor nurse says, "What's the skin look like?"
Exactly. Yeah, and
which might not be fair.
And it's funny because I'm learning from my preceptor, and I still have my floor nurse eyes, and so when I'm doing my documentation and things of that sort, my eyes are looking at, I gotta stage this wound, and I this was here on this skin and this was there, but and I have to also learn to become an ER nurse, and the difference between a floor nurse and a ER nurse there are many differences, but as far as assessment's concerned, as a floor nurse we do head to toe assessment, skin, everything, and from what I'm learning is that we do look at that in the emergency room, but it's very focused. Your assessment is really based upon what the patient comes in for, and those are your real things. If you happen to see some things, obviously tell them in a report, but so I guess some floor nurses, they are very concerned about the skin, whereas I can say,
that's
patient,
what they're supposed to be.
Right. Where I'd be like, well, I was more focused on administering TPA, and the condition, things like that. I
don't think that's so bad. I think when it gets bad is when there's like animosity between the floor and the ER because they think that they're supposed to be more united in what they're supposed to be assessing, which isn't true.
Right. And yeah, it's like I said, I literally can sit here and play both sides.
Yeah.
I can see both sides, and just
part of the stress of the job too is like, you didn't do this, I'm already busy.
One person's thinking on one end, oh, I'm really busy, and the other person's thinking they're really busy. And in reality you both are. It's that weird mentality that floor nurses are just sitting around upstairs and they're just waiting for the patients or whatever. But in reality, they're running their butts off just as much as we are downstairs in the ER, but in a different way. Floor nursing, you can, with the exception of some hiccups in here and there, you could kind of plan your day out. You got your medications at 8, 10, 12, 6, 2, things like that. And you have your floor meds and your assessments and stuff like that. You can kind of get an idea how your day is going to go, with an exception of some tests and stuff that the patient goes to or whatever. On the floor, on the ER, it's just not like that.
Right.
And you got people coming in, coming out, you got discharge, some going upstairs, you got a critical patient, you got a non. So it's like, but both jobs, both floor nurses and ER nurses are really busy.
Right.
Whether
you definitely
one's a
earn your
planned thing or
paycheck
not.
if you're a nurse.
Right.
That's just the way it's been.
So when someone's giving a report and saying, I'm really busy, I don't have time for that, or blah, 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 I try to say, okay, I'll give you a call back. I try to be, an ER nurse to understand what the floor nurse is and vice versa. So nothing's perfect, but.
Right. So what would being a floor nurse, I'm guessing it changes how you give a report as an ER nurse.
Not too much, because, at least for me, because I still try to do a review of systems. Just as if because, floor nurses we still give report to other floor, if we have to, other nurses on our own floor of transfer of care, handoff of care, and then also if they get, if they go to the OR, or if they go to IMC, ICU, if they're getting upgraded, things of that sort. So, you still kind of want to do the review of the systems, respiratory, cardiac, and then some basic stuff. If I know it in the ER, I'll tell the floor nurse. If I've seen their gait and if I've seen their skin, I'll tell them. And
Right.
I usually, once again, I don't know if that's because I have some bias here, but I still look at the skin, as much
Right.
as I can.
If I see it, and it depends on the situation too. If it's not critical, obviously you're going to have more time to do certain things. Or if the patient's ambulatory and needs to go to the bathroom, you get to see that.
Right. You get to see if they go to the bathroom. 90, I don't know, the percentage though, if they're not critical, they're not going to be admitted. You won't be needing a call report anyway.
Right.
So, yeah.
So one of the reasons I wanted to have you on the podcast too is because we're a family unit, and we just recently went through an obstacle as a family, and that was your positive COVID test. So I briefly mentioned this on previous podcasts about, especially the last one, because I hadn't done a podcast in 2 weeks' time at least. And part of that was because we were working through making sure you were okay, making sure Grayson's okay. So can you walk us through a little bit of that?
Yeah. So, I don't even know where to start.
We can start at the positive COVID test. Let's start with the nasal swab.
Well, I wanted, in April, I had some minor symptoms that were along with COVID, a cough and sore throat and some awkward shortness of breath that I'd never really had before, and I was swabbed at work, and I had to be in quarantine for a week and a half, I think it was, because the symptoms weren't that long.
Although it was negative.
And that was negative. So on, I think it was May 4th, actually May 4th is when I went to the hospital, but a couple of days prior, I remember clearly, it was one of our nice days. I've been fine all day and playing with Grayson, everything like that, and I don't know what you were doing, but I remember you came into the living room and I said, "Is it cold in here?"
Oh, right.
And you looked at the thermostat, because it was a nice day, we didn't have the air on or anything, and you're like, it's 75 degrees. No, it's not. And next thing you know, I'm piled. I have got my sweatshirt and sweatpants on, and I'm covered in blankets and feeling miserable. And I had that low-grade fever. I wasn't really sure. I mean, I guess we really didn't really think it was COVID initially because it was just this annoying low-grade fever. No cough, no shortness of breath, anything like that. So, I don't know, 2 or 3 days later, with Tylenol every 4 hours, NyQuil,
You just started
everything,
feeling worse.
it just got worse. And no matter what I used, Tylenol or anything, I just couldn't break this fever. However, it was very low grade. Sometimes I guess you wouldn't really consider it a fever. Sometimes in the 99 range. But it would go up. And then, so I went to the emergency room and where you worked, because I didn't want to go where I worked.
Right.
And
That's
to
a thing.
figure out what that was. And I was swabbed and I tested positive. It did take
2 days.
2 days, I think it was.
Hmm.
For us to find out.
I did a COVID test last night, and within an hour of pickup, it was done.
Well,
It's just different. That test has evolved
well, to touch on
in such a
that,
short
you
period
know,
of
is
time.
what's available. I've had patients where we do, there's a test that you get the result in, 2 or 3 hours, and then some that we send out.
Right.
It really, probably depends on the likelihood of the patient being admitted and things of that sort, on how fast we get them.
Mhm.
And all I had was that one symptom, that annoying fever. So
Right.
I guess that was a couple of days, 4 hours. So because you worked there, 2 days later maybe, mind you, I guess this wasn't the smartest on us, but it still it still didn't click that it could have been COVID, for either one of us. So I was still, I didn't quarantine from you guys.
Well,
or
you had
anything
other
else.
complications on top of that we're not going to really get into. But
Right. Which is why, I really actually went to the hospital and we thought that the fever was secondary to that. But yeah, so I've been around Grayson and you, and the emergency room called me at 11 o'clock at night,
Yeah.
and I missed the call, and you were going in for night shift,
Right.
and they called you.
Right.
You're my emergency contact and so forth, and then next thing you know, you're coming back home, and you're like,
Right.
I'm at the top of the steps. And
I made it
like,
to the parking lot at work, and I was like, I can't go in that building.
Right.
That's the wrong thing to do.
Right.
So I just called, Alc Health had additional numbers for this time period. They had like a late night and emergency number, and there we go. I had a 2-week vacation. Well, kind of.
No, I made sure you worked during that time. So yeah, and I called the occupational health hotline as well, because I was supposed to work the next day, and which I wasn't really going to go in anyway because I was so miserable. So yeah, so that continued, that annoying fever, for about 2 weeks, and the fatigue.
That was probably the worst part.
Was the worst part, and the body aches. The body aches probably were the worst part, to
Yeah.
the point that my skin hurt. The fatigue part, where sometimes I just felt like I couldn't lift my head off the pillow. But then you saw sometimes when my body hurt so bad, I was pacing the bedroom.
Right.
You're like, what are you doing?
You couldn't relax.
And I couldn't. And I remember telling them, or telling you that I can't. I'm so grateful that I wasn't admitted to the hospital, because here I am in our comfortable bed, where it was comfortable bed, and I'm miserable.
Right.
So
Well,
I can't imagine being in
I
a
remember
hospital
your
bed.
experience with hospital beds was never good anyway. I mean, with Grayson being born, you were
Yeah.
so uncomfortable, not just being pregnant, but I think
Right.
everything attached to you, and then trying to get comfortable in one of those beds.
I guess it's pretty safe to say I don't have a very high pain tolerance.
Or you're a very difficult patient.
Or I'm a very difficult patient. So yeah, I had some small gastrointestinal stuff, but not much. Never a cough, shortness of breath, or sore throat. Nothing respiratory.
You didn't
for
have
me.
like any sensation. Like I remember you saying
Oh, yeah, but
it was
I
like
did.
a heaviness almost, but it was never really hard to breathe.
No, it was like a chest tightness kind of thing. And I did lose, or I don't know, I want to say lose. I had a decreased sense of taste and appetite.
Oh yeah.
But as far as smell, I didn't have any issues with
That
that.
seemed like that was pretty widely reported, the changes in senses.
And so, while I guess a lot of people say is that I had the mild version of it, which I'm very grateful. But even at its mild form, it was so miserable.
Yeah.
So,
But luckily, me and Grayson never showed
Right.
anything.
So, to touch on that, while we quarantined as a family, I stayed in a bedroom, which has a bathroom connected to it, and I used that bathroom and stayed in the bedroom. And you
Slept on the couch like
slept
I
on
was
the
in
couch.
trouble.
slept on the couch, and you earned Father of the Year because you were the
Oh my
sole,
God! Again, that is recorded. You can't take that back.
you were the sole provider for Grayson. And me, and my only connection,
Well,
outside of their room.
that's a good thing to bring up too. Is like the isolation. Like you weren't really as isolated as some people were, but you felt the effects of isolation.
I did, yeah. There were a couple of nights.
The loneliness gets to you.
Yeah, and it's kind of like I remember. It reminded me sometimes like of when I was like a young kid and I'd creep to the top. If my parents told me to go to my room, and I'd stand at the top of the steps because I just wanted to come down and hear everything. It's kind of like what I wanted to do with you guys because I was so alone and I was upstairs, and at the same time you're so miserable that you can only be on your phone so much, and
Right.
yeah, it was.
And not being able to touch Grayson.
Yeah,
that
that
was a weird one too.
Yeah, and even you. I mean, not having you beside me, and absolutely. I missed, this all happened during my first Mother's Day.
Oh yeah.
So I couldn't even hold my baby boy on Mother's Day, and it was very
We
challenging.
got swamped with flowers though.
We did.
So you were very well supported even if they weren't here.
Yes.
I spent so many hours putting flowers into makeshift vases.
Vases.
Whatever.
No, I'm just kidding.
I'm going to say vases. I'm American.
Yeah, I do. I have, we have a great family and friends that were very supportive.
Oh, and the
and-
wine fairy thing. Oh my God, we got so many bottles of wine
Yeah,
that
but
you
that's-
couldn't drink.
Right. That was a random thing. That was not really associated to that, but
Oh. Well, I guess you're not upset that I drank 17 bottles of wine while you were on quarantine.
yeah,
No, I
it
didn't.
was fine.
Not a wine guy. Beer fairy, if you're listening out there, that would be a really
One
good
does
one.
exist in this
There is a
area.
beer fairy?
Yeah, but you might get Bud Light.
I don't want that.
So yeah, those were what the symptoms were like. In order for me to return back to work, I needed to be quarantined for at least 10 days and symptom-free for at least 3 days. So I think I was out of work for almost 3 weeks. Yeah, I mean, thankfully I didn't need to be hospitalized and moving forward. And, as far as support is concerned, my sister, as soon as she found out, the first thing she offered was to take care of Grayson. And I think that unfortunately I told her as a family we had to quarantine, including you and
Yeah.
Grayson. And
Well, my side of it was even just you being positive. I had to quarantine for 2 weeks.
Mhm.
And then I was supposed to report symptoms. And obviously that would have gotten longer if I had gotten sick.
Right, and I'm sure if you had gotten sick, then mine would have, well, I don't know if mine would have increased, being that I've had it.
Well, I
but-
guess that's something to touch on too. Is like we're still not there
Antibodies
with the
wise.
research with like what's going on with the antibodies, what's going on with immunity, if there's secondary infections. Although I don't hear many secondary infections being reported.
Well, I will say this, talk about research. The very next morning, like we found at 11 p.m., the very next morning, as you know, 7, 8 o'clock in the morning, I get calls from random numbers.
Oh, that's right.
And it was University of Maryland School of Medicine calling me to study
Be a part
me.
of a study, yeah.
Yeah. And, you know, I get what they're doing, but I was very annoyed because I was so miserable. And I'm like, the last thing I want to do is sit here and talk to you about my diagnosis and whatnot. And surely I didn't even let her go into what it entailed, because there's no way I'm going to go give you blood or anything or leave the house or anything of that sort.
Right.
And then health department, they called me every 2 or 3 days, and they had a whole case on me, and so they needed to know what my symptoms were like at what time and things of that sort. So, that was kind of interesting about that. And then even after now, I have had some random phone calls, but I don't answer them. So I'm afraid, it's somebody, trying to get my blood somehow or another.
Well, I guess you could say on top of that
testing,
too,
yeah.
like we get phone calls all the time from random numbers and we don't
Yeah.
answer them. So I
Yeah,
mean,
my car insurance
oh
warranty.
my God, the car warranties. I don't know how many.
Right.
And then XM radio calls me every day, no matter how many times I say I don't want that.
Right. Yeah. Yeah, I mean, they have slimmed down though.
All right, let's talk about some of the stuff we had to consider as a family going through this COVID stuff. So, like, going into this, we did have babysitters and we did have people to watch Grayson, but, I mean, that kind of fell apart once especially after getting your COVID test, but that fell apart even before that.
Yeah, prior to being diagnosed, we had a pretty decent plan in place. Some other families in healthcare field, if they're both in healthcare or one or the other even, they would send their children off to parents or people of that sort. And you and I made that decision that we didn't want to go that route.
It was a little harder, too, because we had some things to consider, like your parents
Right.
are a little older.
Your father's in Florida.
Right, yeah.
So, so things of that sort, I feel like, we made decisions, and, being first-time parents, they were difficult, as most people would with being in a pandemic. And then on top of that, us both working in healthcare. So, we decided to make sure that we didn't bring anything in the house that wasn't necessary, obviously, that we would strip right down at the door and obviously not touch Grayson until we're showered. And with the situation with the babysitter, we had a babysitter prior to this declared pandemic, and, rightfully so, she decided not to watch him anymore for the safety of her family, and we understood that, with the chance that maybe he would be an asymptomatic carrier, or that one of us, carried it on to him, which we later found out, probably good on her part that she did that, because...
I mean, ultimately we did end up with it. But, I mean,
yeah.
It's not that crazy to think that one of us was going to be COVID positive at some point. And, I mean, I could be asymptomatic, too.
Right.
We're never really going to know where you got it.
No, we don't. And, and some people were like, oh, because you work in the ER, and, but...
You could have gone, out pumping gas.
Right, very much so. And, and I've always told people, too, like, I could have from work, but we wear full PPE.
Yeah.
With the majority of the patients. So it's like, I feel like work is almost one of the least places that I would get it.
And I know I was very precautious, too. Like, if there was any consideration for it all, respiratory symptom at all, like I was taking precautions.
Right. I mean,
but it is what it is. It's a disease.
We'll
like,
never know.
You still get the flu every year, you know.
Exactly. So yeah. So, you know, we also made the decision that, you know, Grayson wasn't going to go to any other family members either because, you know, like you said, with the distance between some families and the population, you know, our parents' age and things of that sort, you know, we didn't want to expose them any more than had to. And, you know, I did get diagnosed, but I do feel like we'd had a pretty good plan in place, you know, with with what we were doing, disinfecting and not trying not to bring things in the house. And because we didn't have a babysitter, which worked out well, is that we alternated our shifts. And so when one would get home, the other would be with Grayson and, you know, help guide that process of swiftly, you know, you would get home and I would swiftly put your clothes into the laundry while you were upstairs showering and, you know, things of that sort.
Right.
And wipe things down and stuff like that.
It took some teamwork.
Yeah, it definitely worked out well that way, I think. Despite.
Yeah. And luckily I didn't get sick,
positive.
so I could spend all that time with him, which I think was pretty cool because I got to stay with him the whole time. Like,
right, you got Dad of the Year.
I get just time with him, which I don't know how that's going to affect him developmentally. I would hope in a positive way, like he's familiar with me. He did say Dad at first, but I also think that they always say mostly say Dad at
You're not
first.
Special.
Yeah, whatever.
Hi. So yeah, and yeah, I think that's pretty much as far as COVID and as a family. I mean, we're still continuing everything, and
there was that concern about children exposed to COVID, and there was like an inflammatory response. But I mean, we were a little concerned about that. But
yeah, because from what I read, there's not obviously a lot of data on it. But there was a young girl that passed away at I believe she was at Hopkins, who was 15. And one of the characteristics of that one was that it was very delayed. And so, and it was in children. So when I saw that, and it was right after I'm starting to get better, I was like, oh my God.
Right.
Like, he's fine now, but what will be happening in a week or two or something?
Yeah, so now with being 3 weeks out, he's been fine. And actually during this podcast, we've had to stop and start a couple times because he demands all the attention.
He does. Yes, he even has his hands up in the air right now and his toes twirling.
And we're watching Inside Out on TV, which is helping to distract me as well.
Yeah, that sounds about right. Yeah, so I mean, overall, I can say that I lived it.
Yeah, that's it. We went through this.
We did it together, and I guess we're stronger for it. You didn't want to kill me,
which
is
second.
Also good news. Cause,
don't go that far.
Yeah, but you didn't.
I didn't come into your room late at night with a pillow in my hand.
But that's probably because you're afraid of getting it. So.
Yeah, I was trying not to pass it to Grayson. That's what I was actually doing.
Exactly. Everything that we did was just for Grayson.
So now, we're just continuing work, and that's it.
Yeah, I mean, even though we still practice everything the same, even though we've had the diagnosis, or I have had it.
There's just too many unknowns.
There are, because, we don't know if there's still if you guys were asymptomatic carriers or not, or have any antibodies. So we still don't know if something can be carried in to either one of you. So we still keep that process in place. I am a little concerned that, with everything slowly reopening.
Well, there's a lot of variables now.
They're going to come back up.
We've got civil unrest. We've got the COVID stuff still going on.
Mm-hmm.
I guess the concern is, like, with all these people not really practicing social distancing, are we going to get more spikes?
Mm-hmm.
But then people at the same time don't seem like they can hold back any longer, so you are getting more of the common things in the ER as well. So this amalgamation of
Everything.
Everything.
Yeah.
Yeah.
I mean, we're kind of, back to our normal, and sad
We're
to
we're a
say,
new
but
normal that everyone likes to say.
yeah, but it's really not. I mean,
Yeah.
it's not. We're back to what it was before. We're at least getting there.
Just we have to take precautions in
Right.
this sense. So.
We do. I just don't know that everybody else is. I think they were a little bored with it. Now, I will say this, whether or not, a surge, quote unquote surge, is going to come through again. I don't know, because there are a lot of people that have gotten it and are immune, or possibly.
And there was a fairly high
Possibly.
percentage of people that were asymptomatic carriers.
Exactly. So, where we started a couple months ago, and not many people have this immunity or possible immunity and antibodies. Hey.
Oh, you got it all over your face.
Hey.
That's nice.
So Grayson's got his noodle dinner all over him, so he's going to be ready for bath time.
Oh, and rubbing his eyes. Oh.
It's a little early.
Yeah.
So yeah.
Yeah. All right.
Anything else you'd like to discuss? While our son sits here.
No,
and
we
puts
can probably
noodles
do
in his eye.
check-ins. But now, anytime we're isolated or I can't find another guest, you can just be my fill-in.
I can. I mean, I am still here with healthcare, and I can update you on my progress.
Oh, that's true too, because
in
now
the
you are
emergency
learning
room.
to be an ER nurse, so
I am, and it's good to.
we can bring up different topics to talk about. Because you
Yeah.
got to get good at EKGs.
I know. I'm dreading this test. I really need to get done. But yeah.
All right. Yeah, I think we'll call it.
Okay.
All right. So this has been the 7th episode. Yes, 7 episodes of the Status Dramaticus podcast. You have heard my wife and my son, who is throwing a tantrum right now because he's done his noodles. So if you want to contact us, you can email me at statusdramaticusrnems@gmail.com. We also have Apple Podcast. You can find us on there if you just type in Status Dramaticus Podcast. We are still on Podbean, and we are still uploading to YouTube. And you can follow me or subscribe to my YouTube channel, the Status Dramaticus Podcast or Status Dramaticus RNEMS. So this has been the 7th episode. Take care, and thanks for
Grayson says
listening,
bye.
everybody. He says bye.